about one main concept that you need to know before doing anything regarding the Schroth method. The most basic thing that you need to know before you start doing any Schroth exercises is called the expansion technique. And what this is a breathing technique that helps to de-rotate the spine, which has scoliosis. So let me show you what the expansion technique consists of. When we normally breathe, if you put your hands on your rib cage, you breathe in through your nose and out through your mouth. And as we can see, when you breathe in, your rib cage expands and goes outward, and when you breathe out, it collapses back down. Because in scoliosis, the spine is curved and the rib cage and the specific ribs are connected to the spine, it causes one half of the rib cage to stick out in the back, and it causes the other side of the scoliosis to be collapsed on that rib cage side. So what we want to do with our breathing is expand the collapsed side of the rib cage or the concave side of the scoliosis curvature. So the way we're going to do that with the expansion technique is on the breath out, we want to try to keep the rib cage big and wide and expanded. So it looks like this. Hands on the rib cage, you're going to breathe in. And then on the way out, I keep my rib cage expanded and I build pressure within the rib cage until I run out of breath, and then I could finally relax back down. So we're keeping that rib cage expanded to open up the collapsed side of the spine. So if my spine is curved to the right in the upper thoracic spine, which is the most common area and direction of scoliosis, I want to try to keep the left side of my upper back, my left thoracic cage, expanded and opened as I breathe out. So you want to focus as you breathe out on pushing your breath out and back into the left side of the spine, the concave side, compared to that right-sided thoracic curve. So let's do that again. Hands onto your rib cage, and you're going to breathe in. Keep it big and expanded, and breathe out. Don't let it collapse until you run out of breath, and relax. So this is the first exercise I teach all of my patients, and the first concept that everyone needs to know before you dive into anything more complicated with the Schroth method. So go ahead, go home, try to just do 4 sets of 5 breaths, focusing on that expansion technique, nice and slow, keeping the rib cage wide. Try it, see what you think, and then let me know how it goes. As with anything, I'd love to help, so comment in the comments below if this was valuable or if you have a question. Have a great day.